Are you suffering from ulcerative colitis, Crohn's disease, or lymphocytic leukemia? Do you want to live life to its fullest without worrying of death? If so, then do we have the drug for you? 6-mercaptopurine, better known by its pharmaceutical name, Purinethol. Originally designed as a cancer medication, Purinethol interferes with the growth of cancer cells and slows the growth and the spread in the body. It's used to treat acute lymphatic leukemia and acute myelogenous leukemia. Purinethol is usually prescribed along with other cancer medications.
That's correct. The drug will act as an enzyme to help break down large molecules within the cancer cells that the cancer cells require in order to make protein, and as a result, stopping protein.
You didn't really believe that, did you? Pharmaceutical advertisements feed gullible viewers lies in an attempt to persuade patients to consume otherwise hazardous products. Day after day, dosable and prescribed dose of medication leave individuals naive towards the side effects included. What if I told you that there was a new predator on the market? Purinethol.
Have no fear, the Adams Family Law Firm is here.
We're a team of undercover agents with the ultimate goal of ridding the planet of misleading infomercials.
Didn't that commercial look familiar? Sunshine and rainbows masking a harsh reality. Despite Purinethol's advantages, its cons far outweigh the pros.
Don't believe us? Numerous medical professionals are in agreement with the Adams family. Allow me to introduce a renowned specialist that may refresh your perspectives on whether or not Purinethol is worth prescribing.
Hi, I'm Dr. Salvi Sir, here to provide some information on the infamous drug of Purinethol. So let's begin. The chemical formula for this compound is C5H4N4S. Its chemical structure includes double and single bonds with functional groups of amines and thiols. Pharmacists refer to this drug as Purinethol, or it can also be called 6-mercaptopurine, or if you're a chemist, like myself, you'd refer to it as 3,7-dihydropurine 6-thiol. Some properties to recognize this compound is that it's insoluble in water, but soluble in hot ethanol and alkaline solutions. Its physical properties include an appearance of a powdered solid of a pale yellow color with a melting point of 313 degrees Celsius with a molecular weight of 152.19 grams per mole. It's stable when it's kept between 15 and 25 degrees Celsius, and it has no reactive hazards. That's all, folks.
Instead of listening to us continue to rabble on about the inefficiencies of 6-mercaptopurine as a drug, let us introduce you to a patient who's already been on 6-mercaptopurine for over a year and has experienced the full force of its side effects.
Good afternoon, Ms. Flavis. I'm Dr. Barrett. I'll be your doctor for today. What brings you to the hospital?
Well, over the past few days, I've been feeling very feverish, a lot of fatigue, and I've been experiencing a lot of diarrhea and bloody stools. Overall, my whole abdomen has been really, really sore. Also, I've been experiencing some canker sores, I believe, in my mouth. Yeah.
Okay, and that's everything?
Yeah.
Okay, I'm going to have my assistant come in and do some blood work, and I'll be back to do your regular checkup.
Thank you.
Hi, darling.
Hello.
So I'm Nurse Sir, and I'll just be doing your blood work for today. If I could have your arm, please. Okay. So you'll feel a slight pinch, so just hold my arm if anything hurts. Okay. You did really well, awesome. And I'll be back with a cotton swab and a lollipop for you, darling.
Well, thank you.
Nurse Sturt, did the blood test results from the patient come back yet?
I fear for the worst, Doc. As expected, her white blood cell count is highly elevated, and there's a presence of ulcers all along the lining of her digestive tract. With the accumulation of all these symptoms, she does indeed have Crohn's disease.
Oh my. Mrs. Lethos, blood test results came back, and I'm going to give you the results straight. You have Crohn's disease.
Oh my goodness. Am I gonna be okay? Doctor, cure me!
Yes, you are going to be okay. There are many treatment options available. The first of which is Purinethol, the one that I personally recommend. The next is methotrexate, and then the third one, which is less commonly used, is cyclosporine.
So, Ms. Lajos, here's your first dosage of 6 mercaptopurine. You should take it once after every meal, and don't skip it, please. And something that I highly recommend is coming back every month, just so that we can check up on your blood cell level, because this drug is an immunosuppressant. And additionally, by law, I have to state the side effects, which include an elevated risk of accumulating lymphocytic leukemia. So we'll see you in a month, and we wish you the best of luck. What appeared to be sunshine and roses for Sophia's prognosis soon turmoiled into her demise after only a few months of using Purinethol.
Purinethol! You have bedridden me for all the infections I have contracted. Month after month, antibiotic after antibiotic. From Crohn's disease to lymphatic cancer, will I ever catch a break? I regret ever taking 6 mercaptopurine. Curse you, Purinethol!
Despite the elevated risk to patients, it also poses a threat to the environment as well as to the general populace. What appears to be standard tap water could contain hundreds of thousands of micromolecules, some of which may be cytotoxic agents, which will deteriorate healthy cells within exposed organisms. Not only that, but the drug lacks the ability to efficiently biodegrade due to its cytotoxic demeanor. As such, its effects continue to persist even after it's excreted from the host.
Additionally, the latter introduces a threat to aquatic organisms residing within bodies of water, as the chemical exits out of the patient's body through waste fluids and subsequently seeps into the sewage system. A minute percentage of pharmaceutical contaminants circulate into our seemingly drinkable tap water. Do drug manufacturers fail to acknowledge the potential long-term threat it poses for healthy individuals and pet rabbits?
If you're an individual seeking compensation
And you're currently taking Purinethol,
Then call us at 1-800-ATOM.
And recharge your quality